Welcome to Heartbreak and Hope with Pat Barbarito, the show that explores how to build up or break down any relationship with confidence, clarity, and compassion. Dr. Matt Iammatteo is an OBGYN. He's been practicing for 33 years. He's a board member and founding member of Lifeline Medical Associates, vice chair of the OBGYN department at Morristown Memorial Hospital here in New Jersey, and he is appreciated, adored, and respected by his patients, and I'm one of them. Here on Heartbreak and Hope, we believe in transparency and authenticity. And what's more transparent and authentic than talking to your very own gynecologist about fertility issues that he treated you for and supported you through. In fact, we went through a lot together. I've vomited on this man. I've cried with this man. I've called him repeatedly. It's been a long, long relationship. So not only has he been my gynecologist for 25 years, I've been his lawyer. We're dear friends. We're professional colleagues. And in fact, at one point, we found out that you trained in the 80s with my former husband when you were out of medical school. So how did you decide? Did you know you always wanted to be a doctor?
I always knew I wanted to be a doctor. And more importantly, I always knew I wanted to be an OBGYN. Ever since I was about 10 years old. When my mother came home pregnant and let me actually feel her belly when my sister was moving, and it just intrigued me. And then she left a few days later and came back holding the baby that I was feeling days before that.
Wow.
So it was a huge turning point in my life at 10 years old. And I said, boy, I'd love to be able to do this for a living, And no offense, but women are much better patients than men. Men are a pain in the neck to deal with. Being one, I can say that.
Women have such a special trust or a delicate relationship with their OBGYN. It's a really special relationship. It's an intimacy that compares with none, particularly when you're going through challenging times. I've been thinking a lot about what was the most heartbreak I had in my life. I thought about a time in my life when I experienced heartbreak that I didn't think I would recover from. The heartbreak of not being able to have a birth child. And to this day, and that's over 20 years ago, I can't compare that heartbreak to any other pain. Profound sadness. I still choke up when I think about it. The intensity was unbearable. But as with most heartbreak, there's hope. I didn't get pregnant despite Dr. Matt's hard work, but I adopted two perfect daughters, Jacqueline and Victoria, now ages 23 and 29. And I clearly was destined to be their mother, and they were destined to be my daughters. But, enough of that, because if you let me, I'll just keep talking about my kids. In any event, we are here to talk to Matt about infertility. Matt, so in general, infertility, as I understand it, is defined as not being able to get pregnant or conceive after a year or so of unprotected sex. That sound about right?
Absolutely correct, yes.
And the CDC tells us that about 1 in 5 couples in the 30 to 39 range have problems conceiving their first child. But by age 40, what I read is an average healthy woman has only a 5% chance of getting pregnant per cycle. Is that your experience?
That's about correct. Might be a little bit low. I think it's a little bit higher than that. But still, at 40, I still consider women fertile up until really 45. Now, does that mean that they are going to be able to get, like you said, pregnant on their first cycle? The answer is no. It may take them several rounds to get pregnant. Infertility decreases with increasing age.
I mean, infertility is such a big topic, right? But today, I'd like to really talk about the fertility struggles of women approaching or over 40. I think that's a unique age group because at the risk of saying it's your last hope or your last stop, it is a little bit. So what is it that happens to a woman's body that decreases their ability to get pregnant as they approach 40 or over 40?
Women are born with a certain amount of eggs, and that's about 650,000 eggs. So every woman is born with around that number. And as you go through puberty and as you go through maturity, the eggs start to decrease every single month, every single cycle. And by the time you get to middle age, I consider 40 the new 35. What used to be 35 was like the big number. Now I really push it off a little bit to age 40. As you get closer to that age, those numbers start to dwindle. And not only do the numbers of eggs decrease, but the number of quality of eggs decrease. So you could have a lot more eggs, but a lot of those eggs may not be healthy eggs. they may be potentially genetically abnormal eggs.
I remember a doctor, not you, telling me, you got old eggs. And I remember thinking, what? What does that mean?
Well, old eggs just means that you're not producing a healthy number of eggs per cycle. That's hard to determine unless you're going through an infertility process already. So there are ultrasounds and blood tests and things like that you can almost predict how a woman's fertility is going to go after a certain age.
I can remember 20, 25 years ago when I went through my fertility challenges, which were age related. I was 40, 25 years ago. And I felt, and I know you were connected at every stage with me, every heartbreak, every sad moment, every loss. I remember, though, so clearly one of the surgeries that I had that you performed. And I remember waking up from that surgery and you literally had a tear in your eye and you said, I know you've been in a lot of pain. I'm really sorry. That kind of compassion and connection, I'm not so sure people see that when they think of their doctor. It's really a special gift.
Well, thank you.
I mean it. You know, and that was after I threw up on you.
Which, by the way, is my worst fear, is vomit.
Yeah, I know. And it was all over you. And you were gracious as could be about it. And you were kind as could be about it.
I tell people it's a one surefire way of getting me out of the room, vomit on me.
Would have never known it, my friend. Would have never known it. But, you know, when somebody comes to you, and again, they're at that age where they say, you know, I'm going to be 40 or 42 and their first child and they want to get pregnant. I mean, how do you break it to them?
Fault me for this, but I'm an eternal optimist. So if
you are. It's
and
remarkable.
If you remember, you know, even with you, I was very, very optimistic that we were going to get there. No matter what we had to do, we were going to get there.
And by the way, we could have kept going, except I found perfect children. But go ahead.
Earlier on, you mentioned about waiting a year of unprotected sex. Most of the time, by age 40, women have already gone a year or more. So by the time they come to me, they're telling me, listen, I've tried for the last year. So I paint a very black and white picture for them at that point. And I basically tell them that their ability to conceive is low, but it's not unattainable. At 40, I usually give them a short period of time of trying on their own if they haven't been trying successfully, nor have they been trying religiously by the methods of mid-cycle coitus. But I give them a short window, and that window is usually 3 to 6 months tops. And if they're not pregnant within that time, I don't want to waste too much more of their time, and I send them to my infertility people at that point.
It seems to me that younger women are much more informed than women of my generation. You know, my experience was we were the generation that understood that we could do everything. We could have careers and we could have babies in between and there was no time frame. And maybe it was just me, but we weren't as aware. Maybe information wasn't as readily available. The internet wasn't there. When I talk to my daughters and their friends, they're very aware of the timelines and what their options are. Do you think it's a difference in the last 30 years?
100%, completely. We knew very little 30 years ago. Of course, we had IVF and we were, scratching the surface of that, which has now blossomed into saving many women's happiness, couples' happinesses together.
How has IVF changed in the last, say, 20 years? I mean, how has it evolved? Because when I was going through it, I don't think we were informed. I don't think anybody understood it. And it was painful.
Completely different process now. Back then, we were just putting eggs into uterus, fertilized eggs into uterus. You were getting twins and triplets. And now it's a much more precise process. There's a genetic process involved. They're putting in normal eggs that have been fertilized, that have been tested genetically. So they're putting in an egg that in the right host, it should take well.
I remember there were, do you want 2 eggs or 5 eggs put in? And it was your decision. And I remember having to make a decision about, do you have selective termination? Do you not? And there was no guidance out there. So women were having twins, triplets, without really understanding what that meant. As I understand it now, I know a young woman who just went through fertility, a friend of my daughter's, and they gave her 1 egg. Why has that changed?
We've learned over the last 30 years that with infertility, with IVF, come a lot of complications. A lot of IVF pregnancies are considered high risk because of increased placenta previa, placenta accreta. These are all things that can happen because of the placentation of the egg into the uterus. So complicate that with twins and triplets or quadruplets. It just magnifies the possibility of having potentially bad outcomes. So we've gotten to the process now where we can maybe have 15 or 20 eggs fertilized, and then we can selectively put the good eggs in 1 at a time. Now, somebody may say, can we put 2 in? Most infertility people now are really only putting 1 per cycle.
I literally remember 3, 4. In fact, I remember the doctor saying, do you want 2 or 5? I'm thinking, are you crazy? And then they said, well, don't worry. Later on, you'll decide what to keep.
Well,
doesn't happen anymore.
Yeah,
Good. Because it's torture emotionally.
Right. That does not happen anymore, at least not in the centers I work with.
Yeah.
They are putting in the 1, maybe 2 at the very most. But back then it was, I hate to use this term, but it was a crapshoot. Well, we got 5 fertilized eggs. Let's put them in. Half of them may be good. None of them may be good. You may wind up with 0. Now, because of genetic testing and because of the enhanced fertilization process, we're able to genetically put in the 1 or 2 better eggs that will hopefully get us a full-term pregnancy.
So you're a woman over 40 or about 40, and the quality of the eggs and the chance of pregnancy diminishes. There's something sort of unfair about the fact that men could have children forever. Does their sperm quality or quantity reduce as age goes on, or is it just women?
No, it does. The thing with men is that their replication process is constantly going on. We're not born with a certain amount of sperm. Our sperm production is constantly changing every day, every 24 to 48 hours. We're turning over new sperm. Whereas women, as I said before, are born with a certain amount of eggs, and those eggs start to diminish once you start hitting puberty. So men their quality of sperm may go down, the quantity of sperm may go down, but their production of sperm is always going to be going on.
So one of the things that you mentioned is the quality of the eggs and genetic abnormalities. What is the reality of genetic abnormalities at 40 plus?
Well, over 40, the likelihood, and this is with a spontaneous conception I'm talking about, not IVF process. With a spontaneous conception over the age of 40, there's about a 1 in 10, 1 in 12 chance of having a genetically abnormal child. Now, 10% in medicine is extremely high. So those women we have testing for those women that do get pregnant to assure them a genetically normal child.
So you have to often tell someone that you have a genetic abnormality. Is that usually discovered in the first trimester, second, third?
So there's a big difference between genetic abnormality and congenital abnormality. A genetic abnormality is an abnormality that's caused by either abnormal sperm or abnormal egg. That's genetic. Many, many different types of genetic abnormalities. A congenital abnormality is the development of the fetus in utero that can sometimes be abnormal. Abnormal position of the heart, abnormal function or abnormality of the anatomy of the brain, the liver, the kidneys, may be born with just 1 kidney, non-functioning kidneys. A condition called gastroschisis, where the abdominal contents are grown outside of the fetus, is a congenital abnormality. So there are congenital and genetic abnormalities, which are all increased with age.
So what happens if you realize somebody has a genetic abnormality? Is that usually discovered in the first or second trimester?
Well, fortunately with technology today, we can find most of these things out. Genetic abnormalities, we can find out usually by 10 to 11 weeks.
What is a genetic abnormality?
Genetic abnormality, cru de Chat, Potter syndrome. These are things that can be picked up on an amniocentesis. Now we have other testing done early on, blood tests that can tell us the sex and genetics of the baby by 11 weeks. Gosh. So we know if a baby has a genetic abnormality, usually by 11 to 12 weeks. We can then confirm it with amniocentesis or chorionic valley sampling to make sure that the test is correct. But these tests are so specific these days that most of the time that alone will suffice for a definitive diagnosis.
But a genetic abnormality is not an abnormality that would lead to a termination, or is it sometimes?
Sometimes if it's non-compatible with life, yes. Trisomy 13, trisomy 18. These are severe congenital and genetic abnormalities which just do not sustain life. They usually stop their own growth by 13 or 14 weeks, but sometimes they don't. Sometimes they can go all the way to full term. And you have to explain to the patient, to the couple, that they have this particular abnormality, and you talk with them as to what their options are.
So we have genetic abnormality and congenital abnormalities. Either way, a mother receiving that is overwhelming, confusing, frightening. But I'm interested now in how you deliver that news and what that experience is like.
Well, the best word I can come up with is devastating. You've spent all this time trying to get pregnant. You are pregnant. You're happy as could be. Now you're told, well, let's use the example of trisomy 18. You have a trisomy 18 baby. Now, they usually stop growing at 11, 12 weeks. However, they can go all the way to term. So now you're dealt with, okay, what do we do with the information that you have? You can tell them that this baby is definitely not going to live, beyond perhaps a couple of days at the most after the baby's out. Do you proceed with the pregnancy? Do you stop the pregnancy? And this is a very, very difficult decision for everybody involved. The parents who have been trying for so long to get pregnant, for myself, because it's a situation where I'm not giving very happy news. So it's one of the biggest challenges we have as medical professionals to have to deal with our patients.
So, we all think of pregnancy, having babies is euphoric and happy and everybody celebrates, but we often don't see the other side of it. The moms and dads and doctors who have to make these really difficult decisions. Do different people process that decision differently? What are the factors that go into making those really tough, heart-wrenching decisions?
100%. I think a lot of it has to do with their religious backgrounds. I think a lot of it has to do with what they've been through, their families, how many children they have at home, if any, and how it will impact the other children.
Economics
have an impact too, because a lot of times these children are debilitated and they have to be cared for in different ways, and really takes a lot of financial commitment of the family.
So I know, Matt, that sometimes in the depths of great despair, there are positive outcomes. Can you talk about any of that to us?
Sure. Unfortunately, in today's day and age, we're picking up, in a good way, we're picking up a lot of disease early on, and these women are going to live good, healthy, prosperous lives. However, when you are pregnant and you have, for example, breast cancer, it's a riskier situation when you are pregnant to have breast cancer, because you're in a high estrogenic state the entire time. And if your breast cancer is being fed by, higher estrogens, it may decrease your prognosis. But I've had women that have had mastectomies during the pregnancy and still gone on to full-term, healthy, normal babies, and they're going to fortunately beat their disease.
Unimaginable to be going through cancer treatment while carrying a baby. I suppose carrying that child is what gives them hope.
Absolutely. It gives them all the hope they need, knowing that they're going through this and they're going to have a gift, the biggest gift that they could possibly have. And that helps them through the process of the turmoil and torture that they're going through, being dealt with a terrible disease.
So you're dealing not only with their physical health, but the health of their child, the birth. There's so many moving parts in that situation. How do you handle that?
It's a good question. I guess it's just innate for me. I think compassion is the one word that I think probably sums everything up. I think if you do not have compassion as a physician, you probably should be doing something else. As I tell my residents all the time, it's very, very easy to be there in the good times. Delivering a baby, a full-term baby, a healthy baby. It's what we do. It's what we live for. It's what we do, and that's our goal. That's our passion. But I tell them it's easy to be there for those times, but it's more important for you to be there for the tough times. And the tough times include bad outcomes, having to tell somebody that they have a genetically or congenitally abnormal fetus that they may have to make a decision on. And my office staff is very much involved in this process with me as we're telling them, this potentially very horrific news. So I've always felt that being there for tougher times is more important than being there for good times.
One of the things that we set out to do when we started this podcast was to make the idea of talking to a divorce lawyer a little less scary. I'm hoping that this episode helps our audience understand that speaking with your doctor, your OBGYN, shouldn't be scary or intimidating. I think that when you peel back the curtain and you understand the compassion and the emotion involved from your end, it helps people open up, share, and understand that they're not in this alone.
I think, as a physician, the most important part of dealing with people's problems, and this goes whether it be pregnant or not pregnant, is to bring yourself to the human level of what they're going through. Unless you can have compassion and empathy for what they're going through, you're just a mechanic. You need to really get into the emotional aspect of what that particular person is going through, whether it be not being able to get pregnant, breast cancer, cervical cancer, uterine cancer, any kind of problem that they should be going through. You have to be able to bring yourself to their level and try to communicate with them at their level of pain or euphoria too, when it comes to it.
When somebody doesn't get pregnant either the old-fashioned way or through fertility treatments, there are other options. Can you talk to us about the other options?
Well, I deal with residents, on a daily basis, and a lot of them are in their early 30s, and they may or may not be with someone. They ask my opinion and advice on certain things. But one of the things that I try to impress on people around the age of 35, 34, 35, who are not in a steady relationship is egg freezing. Now, this is a process where the earlier you do this, the better, because if you're 40 trying to get pregnant, your eggs are 32, then you have 32-year-old eggs, not 40-year-old eggs. So
but how about the carrying process at 40? Even if your eggs are young, does carrying a child at 40, is that challenging, or is it really the quality of the eggs and the eggs that's the issue?
It's the quality of the eggs that's the most important thing. And then, of course, the health of the patient.
Yeah.
You can have a 40-year-old patient who's in great shape.
Yeah.
She's going to have no trouble carrying a pregnancy. You have someone at 40 who's not in great shape and may not have a good uterine lining to accept a pregnancy and may not be able to take those good eggs and take them to term.
So what does egg freezing mean? It sounds like such a out there thing to do.
Well, it used to be in the past. Now
Yeah.
it's a very simple, straightforward
What is it?
thing. Basically, the infertility people will stimulate the ovaries to produce eggs.
With a medication
With
or
medications,
shots?
yes. And then they will withdraw the eggs, usually through a minor surgical process where they can extract the eggs, keep the eggs, and freeze them so that down the road they can be fertilized by the patient's partner and then put back into the patient's uterus.
So we're talking about unfertilized eggs.
They're unfertilized, correct.
Because, you hear these famous cases, these movie stars who have had fertilized eggs, or even not famous people, and then there's litigation over whose eggs they are, and that's another conversation. But you're talking about a woman taking her own eggs, having them extracted, owning them, and it's her decision whether or not to ever have them fertilized or let them expire?
Well, they never can really expire. You could either use them or you would not use them. You could just basically terminate them.
And do you see a lot of young women opting for this?
A good number, not a large number, but a good number of women who are in their early to mid 30s, usually women who have high profile jobs that are not in relationships. And, they ask your opinion of, well, what should I do at this stage of my life? And that's a perfect scenario for a 33-year-old attorney who's working her butt off
Yeah.
to make a name for herself. She just hasn't met the right person. That's a perfect person.
Or doesn't want to have a child alone.
Or doesn't want to have a child alone. It's an expensive process, but it's a good idea to keep those eggs at 33. She may meet somebody at 34 and they may give her 30, 35. They don't have to use those eggs. They could certainly try on their own, but she has that as basically a safety net.
Understanding that science has really progressed and has done so much for our lives in so many areas, it does seem doing that is a little bit of interfering with nature.
Well, medicine in general is interfering with nature.
Yeah.
I mean, medicines that we take to prevent disease is, interfering with nature. So this is a more natural way, I think, of preserving someone's fertility.
So talk to me about surrogacy or carrying a birth child but using somebody else's egg. Those are two other sort of nuanced options to have a birth child, but not the old-fashioned way.
Yeah. I've had several cases where surrogates have come in.
How does that work?
First of all, it's best with surrogacy to know the surrogate very well, because then, as you will know from a legal standpoint, you get into a very, very messy situation. The ones that I've dealt with have been very closely knit people that knew each other ahead of time, were friends ahead of time. I've had family members that have done it for one another, and it goes very, very smoothly and very nicely. I imagine in a situation where someone is doing it strictly for financial benefit, that it could be a little bit dicey when it comes to the birth and afterwards from a legal standpoint. But from a medical standpoint, I think it's an excellent way to go. I've had a couple of women that I've told, they really couldn't get pregnant because of medical conditions which were just not compatible with her being able to carry a pregnancy, let alone get pregnant, just carry the pregnancy. And they found the surrogate, or they had family members or very, very close friends as surrogates. And it worked out great. They come in together. They're very much involved. The husband, who it's his sperm, but being carried by someone else, very much involved, very much into it.
So with surrogacy, is it the surrogate's eggs?
So most of the time, it's the mother's eggs and the husband's sperm put into a different human being.
So that person is the carrier, the
They're
oven,
the carrier.
so to speak.
The surrogate is the carrier
Okay.
of their child together. Now, that's if she can make eggs. Now, sometimes you have a woman who has a double whammy where she doesn't have her own eggs and doesn't have the uterus that can support a pregnancy. So in those cases, that's where you have a surrogate who has perhaps the husband's sperm fertilizing a different egg from a different person being carried by the surrogate. Usually it's not the surrogate's eggs that are being carried.
Right, because there's a whole emotional component to carrying your
that's her genetic. It's her genetic child,
and there's a lot of legal issues with that. So we're not going
Exactly.
to go into those now. But how about egg donors? What is your experience with that issue?
Just like sperm donors, there are egg donors. There are women that actually get paid to go through an IVF process to produce eggs that can then be fertilized and put in a person who cannot get pregnant.
And have you had experience with that?
Oh, several times, yes.
Is there an emotional complexity that you experience with surrogacy or egg donors that you don't experience in women who've gotten pregnant through IVF with their own eggs and partner sperm, or in same-sex couples?
I have enormous amount of same-sex couples in my practice, which are, they come in together. They're wonderful. And again, I've had them where I've had basically right now, I've had two people that are both pregnant from, that are, from the same sperm donor, but, her eggs are hers and the others are her eggs. So when you get into the whole topic of donor eggs, so you have a couple that she no longer can produce healthy eggs. The man can still produce healthy sperm. So you have to now make the decision, okay, do we go with donor eggs in my body that is not my egg, but it's my husband's sperm, okay? And some women are a little bit skeptical with this. They're a little bit skittish with it. They don't feel as though it's really going to be their baby. That baby's growing inside of you. That's your baby, period, the end. That's all I have to say about that. I think men have more trouble with that than women do. I think men have a more difficult time. Forget about donor sperm, but I think they just have a more difficult time even with a donor egg to put into their wife's body and go to full term. They come to grips with it. They all do. But I think it's emotionally before the process starts, it's a little more difficult for the man sometimes than the woman.
All this pregnancy, having children, procreating, leaving a piece of yourself on this earth is such a deeply emotional issue. Isn't it? I mean, it's fascinating. You see it every day. But the emotions that rise up in us when we think about having a child, it's not like nothing else.
There is nothing else like it.
Right?
I tell my own children, you won't know anything about the word love until you have a child.
Jackie, my 29-year-old, had a baby 14 months ago, and watching her raise this baby, have this baby, nurse this baby, it's been extraordinary. I've seen a side of her that just humbles me beyond words. And again, as an adoptive parent, I don't even think of my kids as not my biological children. And my girls, I think that they were intended for me. So I think that any child you bond with or you form a connection with is your child. But there's something about the drive to either have a child or raise a child that's just like no other, isn't it? Yeah. We just stop at I knew I was stopping at nothing until I found my children, and I did. Yeah. But it's remarkable.
It does overwhelm you, and it does overcome you. And I've seen relationships break up over it too.
Yeah. How so?
Yeah. Well, the couple gets to a point where that's all they can focus on. And it's, I would have to say in my experience, it's probably more the women than the men that it can become so obsessed with it because they're the ones going to be carrying the baby. And it's every woman's right as she sees fit to have a child.
But it interferes with the sexual relationship. That's a big issue. Can we go there?
Sure. Absolutely.
Let's go there.
There are times when, a man, has to perform, at a given second. Okay. Most of the time for men, that's pretty easy. However, when you're doing it for procreational only, and it becomes more of a task and a job rather than a pleasurable experience, it starts to wear on you after a while. It wears on men and it wears on women. And they get to the point where, the woman becomes so obsessed with not being able to get pregnant that it starts to ruin the relationship that they have. I've never thought, in all my years when I first started 30 years ago, that stress and inability to conceive had anything to do with stress. Now, completely different. I absolutely think that stress.
Why do you see it differently now?
Because I've seen the stress that women go through, the stress that men go through after trying for 3, 4, 6 months, a year, 2 years, that it completely consumes them. And that's all they focus on. And it really has an impact on their ability to ovulate, ability to conceive, ability to perform as a man. A man is not a machine, you can't just.
They get resentful.
And, and then it becomes, an issue and, can lead to different types of erectile dysfunction for men.
Well, because quite frankly, the playfulness and the sensuality is taken out of sex when it's just for procreation purposes. I mean, I suppose there's some religious people who might think that's the purpose of it, but I think the rest of us mere mortals think sex should be pleasurable and fun and not just for procreation. And I think it's heart-wrenching to see people feel worn out and beaten. And then again, I remember my own times. It's sad. There's the pleasure, the fun, the spontaneity is just shot.
Gone.
Yeah, and it's sad. And relationships do take toll.
I've unfortunately seen, too many of them dwindle when they were just unable to accomplish what they had hoped to set out for together.
So when that happens, particularly people of a certain age, you have a 40-something-year-old woman whose relationship is fraying because of the demands of what's necessary to have a child. See, that's what's so sad to me.
Yeah.
They just hit a wall. That's sad because if you're in your 30s, there's another relationship out there or there's other options. Mm-hmm. But when you're in your 40s and your relationship is done and your eggs are old and you're not producing them, that's heartbreaking.
That's the roughest area that we have to deal with right there.
Matt, does there ever come an age where you say to a woman, and I don't know if this is a doctor's role, you're 50. You shouldn't be giving birth to a child. I don't care whose egg it is. Or have you delivered babies of women of a certain age?
Ironically enough, 2 weeks ago, I delivered a 50-year-old. So
50?
50. I mean, if they're a healthy 50-year-old and someone, don't forget, they go through a very strenuous process too, because the IVF people don't just put eggs in anybody.
Is that true?
They're diligent, they're ethical. So somebody age 49, 51, and I've delivered many women within the ages of 48 to 50.
Wow.
Especially, 48, 49.
Any of them get pregnant the old-fashioned way?
Couple.
Wow.
Yeah, couple. Not 50. A couple at 46. Several.
So what kind of testing or screening do IVF people go through when somebody's 50? Well, first of all,
at that age, they have a psychological workup. Okay, so they're seen by their psychologist. They obviously have an extensive medical workup done by them. They make sure that their heart, lungs, that they're, because at age 50, your capacity to increase your blood volume and increase your cardiac output, increase your blood pressure, and all the other things are going to be increased. Your potential to develop hypertension, diabetes, preterm labor, these are all things that are going to increase as you increase in age as well. So they're not too quick to say, oh, let me just, have you come in and we'll get you pregnant at 50 and without doing their due diligence. So they do a very strict screening process. And if someone is completely unhealthy, they're not going to take someone who is morbidly unhealthy and say, it's time to get you pregnant. They're going to have a discussion with them, and they're going to, especially the people that I deal with in particular, all have a very strict screening process for their.
So there's an ethical code involved in delivering a child or helping somebody at 50 get pregnant.
Yes.
And do you ever think or say to a patient, you're just too darn old? That's not your job. That's
not my job to do. I think if someone has the will to do and they have the passion to do it and they have the ability to and they're medically sound to do it, that's their decision, not mine.
So what we've learned today is that there are all kinds of ways to become a parent. Natural pregnancy, IVF, surrogacy, egg freezing, adoption. There's just so many ways to become a parent. And I think that the message I hope we give to our listeners is that, first of all, DNA does not define you becoming a mother. No matter how you become a parent, you can become one if you have the will to do it.
Absolutely. And I think, as I said earlier on, eternal optimist. And if that's what you want to do, then you should do it.
Yeah, you believe that everybody could be a parent.
I do. I mean, if
you want
to be.
Right. Not everybody should be and everybody wants to be. And I don't make judgment on anybody who chooses not to be.
Neither do I. Of course not.
No.
But if they want to and they have the resources to, they can certainly accomplish their goal.
Well, I thank you so much for being with us, Dr. Iammatteo. Certainly, it's been a wonderful journey. Thank you for joining us. Thank you so much for joining us today. Don't forget to follow us on your favorite podcast platform. Please give us a 5-star rating and leave a review so more people can listen in to Heartbreak and Hope with Pat Barbarito.